Ms. Barragán for her 5 minutes of questioning of California.
Thank you, Mr. Chairman. Mr. Lipschultz, I want to start with you. First of all, thank you for the work that you do for the Center for Medicare Advocacy. Last year, Republicans' priority was to give tax cuts to the rich and take away health care through Medicaid. And even though the bill doesn't mention the word Medicare, according to the Congressional Budget Office, absent future congressional action, the bill will trigger $490 billion in cuts to Medicare from 2027 to 2034 due to the Statutory Pay-As-You-Go Act of 2010. Can you talk about what it will mean for recipients of Medicare if there are $490 billion of cuts to the program?
That would be a significant cut that would require perhaps cuts to benefits, cuts to provider payments, reorganization of the way that people access health care. If you'll permit me, I would like to address the impacts of H.R. 1 on Medicare. In addition to the cuts that providers will face as a result of significant cuts to Medicaid, the same providers that treat Medicare beneficiaries, and in addition to potential cuts that states will have to make to their Medicaid programs because of these cuts, services that people who are dually eligible for Medicare and Medicaid both use, H.R. 1, for the first time, strips away Medicare eligibility and coverage for entire groups of people. Now, undocumented individuals have never been eligible for Medicare, but this bill strips away eligibility and coverage for groups of lawfully present individuals, regardless of how long they have worked and paid into the system. As previously mentioned, this bill also delays changes that were meant to streamline enrollment and accessibility for the Medicare savings programs, which helps people afford their Medicare programs to the tune of, according to CBO, $66 billion in savings, which is money that otherwise was going to come out of people's pockets. In addition, if you permit me just one more point about H.R. 1, it also has an impact on Medicare prescription drug negotiation. The Inflation Reduction Act exempted certain orphan drugs from negotiation. H.R. 1 expands that exemption so that the Medicare program will be paying an estimated extra $8 billion over the next 10 years as a result of that change.
Thank you. The other topic, of course, that everybody's been talking about, but except for Republicans, has been the Affordable Care Act tax credits expiring and people losing their coverage. So I want to echo the concerns that have been raised, that we haven't had a hearing in this committee for months, and instead of having a hearing on what we can do to make sure more people have access to health care and keep their health care, we're talking about Medicare, which is also, again, very important. But what's before people right now is their inability to afford their health care. Mr. Lipschutz, I want to follow up with you. Nearly 1/4 of the ACA enrollees are at least 55 years old. Many are early retirees who have to purchase insurance on the marketplace because they're not yet eligible for Medicare. If older Americans are forced to delay care because they can't afford it, doesn't that mean they're going to be more sick and need more expensive care by the time they need Medicare?
Very likely. Right now, the expiration of the enhanced subsidies, 50% of the people who will lose it are between the age of 50 and 64, which means their premiums are skyrocketing, particularly compared with other groups of people. So yes, more people will go uninsured or underinsured, will delay care, will defer care, will go into debt, and will face bankruptcy because of health care costs.
Thank you. I'd also like to, important bill I think is missing from today's hearing called the Promoting Access to Diabetic Shoes Act. This bill would authorize nurse practitioners to certify a Medicare patient's need for diabetic shoes and refer them to a podiatrist. So patients with Medicare can more easily get the care necessary to prevent diabetic foot ulcers and other conditions. That's why I hope we can consider this legislation and have a hearing on it, included on at a hearing. I'm proud to co-lead this with Representative LaHood in a hearing soon, and with that, I yield back.
Gentlelady yields back. Now recognize the gentleman from Georgia, Mr. Carter, for his 5 minutes of questioning.